I had to look this one up. The difference in the scope of practice between a physician and an advanced practice provider, specifically a nurse practitioner, the terminology is the two are not the same in any way, let alone can you compare what I believe this tribe member is trying to say is what can the physician do that the nurse practitioner can't do. So let's define some terms. First of all, there is no scope of practice for a physician. They have license to practice medicine. Period. Big umbrella, practicing medicine. And then they further can specialize in a specific type of medicine or specific type of practice. The example I'll give is, practicing the umbrella term medicine. It's kind of like what PCPs or hospitalists do. And this is super overgeneralized, so please don't send me any correcting messages. This is just my interpretation. And a specialist would be like someone I work with, like an intensivist, a critical care physician, a pulmonologist. You could further take it several steps further, and a surgeon, because a surgeon starts out as a physician and then trains to become a surgeon over years of training. So I think that's the best description I'm going to give without totally chopping it to pieces. A nurse, on the other hand, has to practice within a scope of practice. They don't have license to practice. And let me clarify, we're talking a nurse practitioner, because a nurse, whether registered, licensed, practical nurse, they have their own separate scope of practice. And it's practicing within the letters of the law that are dictated by your education and training. Which I guess is a good description for comparing it to a physician. Because a physician is practicing within the letter of the law based on their education and training. And a physician has years more experience of education and training than any type of nurse. Formal, and they have different type of education. So a nurse, registered nurse, has to practice within their scope of practice, which is based on their education and training. They have to have a certain number of hours before they can sit and take their licensure exam. And the same thing is true for a nurse practitioner. A nurse practitioner, regardless of specialty, has to have certain number of hours, clinical experience, formal education in the classroom and outside before they can sit and take their licensure exam. And their licensure exam is based on whatever specialty direction they take. For me, I am an acute care nurse practitioner, but I am an adult nurse practitioner. That is my small specialty. So as an adult acute care nurse practitioner, I can work wherever my skills are needed. Within my scope of practice and in my state, that is also garnered and dictated by collaborative agreement with my physician. And any physician anywhere in my state, you have to have a collaborative agreement. So my skills have to be my work has to be supervised at some level by a physician. There has to be physician oversight. So the best description is that a physician has the umbrella type of responsibility, and then the nurse practitioner is someone that the physician can delegate their responsibilities to. In the real world, we share those responsibilities. It's not like they stand around and watch us work. In the environment I work in, we share and collaborate our responsibilities. My critical care physicians and intensivists have years more experience and specialized training, and they are a licensed physician who can practice medicine. I can't practice medicine. I practice within the constraints and the framework of medicine. I can diagnose, I can treat, but my training didn't start in medicine. It started in nursing. I have transitioned to the medicine model. It's a very convoluted concept, but the bottom line is a nurse practitioner has a scope of practice, and a physician has a license to practice medicine. And that's probably the bare bones best definition that I can give you.